Hello friends, myself Dr. Shashank. Today I am going to speak to you regarding the approach to the fever, okay? Regarding the approach to fever. So it will be in a classified manner. Today I am going to discuss regarding the introduction, okay? Just the introduction part of this fever I am going to discuss. So basically when you talk about fever, two things you should keep in your mind, okay? One is infection, the other one is inflammation. Okay, these are the two things you're going to keep in your mind when we start about the fever. What is infection? When an offending agent is attacking to the body, that process is called as infection. Okay, then what is inflammation? If suppose there is an agent that is causing the cell injury, okay, agent that causes cell injury, okay, the agent is causing the cell injury. Once the cell injury is caused, that is going to activate the WBC. So these WBCs will release something called as mediators, okay, that is inflammation. So what are the signs? Basically, what are the signs of inflammation? Or first we'll discuss the causes, okay? First we are going to discuss the causes. So what are the causes of this particular fever? First thing is, as I've told you, infections are the cause. Okay, then allergens. Have you heard about allergy? Right, allergens are also cause of fever. Then trauma, don't forget, any kind of trauma can also cause fever. Coming back to the signs, as I've told, so what are the signs of fever? Ruber, Caller, Dollar. Have you heard about them? Yes. In simple words, they are called as redness, then warmth, then swelling, then pain, then fever. These are the five signs of this particular fever. Fever is also a sign of fever, okay? It's a little ironical, but still. First, talking about the inflammatory response, which is very, very important in case of fever. What our body does when an offending agent is entering into our body, that is inflammatory response, okay? First we are going to talk about the local thing, then we are going to talk about the systemic one, okay? In case of local, what happens is, the main thing you're going to remember are the sequence of event. First is vasodilatation. If this vasodilatation is occurring, that will lead to erythema, that is the flushing of the blood due to increased blood supply. Then increased capillary permeability. If this particular capillary permeability is increasing, that will lead to edema or swelling. Then activation of pain pathways, okay? Pain pathways have been activated. If this pain pathway has been activated, it is very helpful for us to recognize the event or the pathology or the problem, okay? So what are the main mediators here? Prostaglandins. Then activation of chemotaxis. What is chemotaxis? Basically, there it is going to attract the WBC to the site of infection. Got it? Then what is systemic? In systemic, only brain is involved, okay? Here in case of brain, what happens is, these both prostaglandins and interleukin 1, they are going to reset thermostat, okay? They're going to reset thermostat in hypothalamus. This is what you're going to remember in a simpler manner for the inflammatory response. Then talking about the individual local response, that is, the first thing is vasodilatation, right? What is vasodilatation? Vasodilatation is increase in the diameter of the blood vessels, that is called as vasodilatation. As I've told you, what does it help for? It help for formation of erythema, that is blood flow is increased. If this particular blood flow is increased, that is increase in the blood flow, what happens is, this blood will be carrying nutrients, right? Nutrients and WBC, so that it can help in the inflammation. Then is chemotaxis. What is chemotaxis? in case of chemotaxis, there is increased WBC recruitment to the site of infection, right? Then capillary leak. What this capillary leak will lead to? That will lead to the seeping of antibodies to site of infection. Okay, to the site of infection. Got it? Then what we talked about, the pain pathway, right? Once this pain pathway is activated, how it will help? It is going to recognize the problem. It helps us to recognize the problem in the body. Okay, the last but not the least, the fever. As I've told you, it's very very important. Why fever is important? If there is increase in the temperature, right, what it does, it is going to inhibit the pathogen activity. Okay, the pathogen activity is not brought about by 100% by itself, so that it can reduce the virulence caused by the pathogen. Okay, then talking about the pathogenesis. So when I told you in the previous slide, the systemic response, what were the two things I told? One is prostaglandin, other one is interleukin 1. So what they do, they're going to reset the thermostat, right? They're going to reset the thermostat where? In the hypothalamus, right? They're going to reset the thermostat in the hypothalamus, right? Once this reset is been done, what happens is there are two kinds of resets. Either you're going to reset it to the higher point, either you're going to reset to the lower point. So when there is increase in the thermostat, that is heat is generated here. Okay, heat generated here, the heat is dissipated. Okay, heat dissipate. Okay, these are the two things how the body works. If the temperature is increased, that is heat generation. If the temperature is going to decrease by the thermostat, then it is heat dissipation. So as I've told you, heat generation, what are the causes basically here? One, I have told you, vasoconstriction, right? If vasoconstriction is occurring, then the temperature of the body is going to rise, of course. Then is shivering. There is increased activity of muscle contraction, that will lead to the heat generation, right? That is what shivering, that is how the body behaves during the fever. Have you ever felt the shivers? Yes, of course. Then in case of heat dissipation, how are you going to release the heat from the body? The main mechanism what you're going to see is the sweating, right? Sweating is the main mechanism of heat dissipation. To represent it in a graphical manner, it is in this way. Okay, suppose this is x-axis, y-axis, this is x-axis. Okay, this is how. First, take suppose our body's normal temperature is 98 degree Fahrenheit, not Celsius, 98 degree Fahrenheit. Then thermostat has been reset to 102 degree Fahrenheit. Okay, what happens is our body will be maintaining a constant temperature because of some event. As I've told you, one is shivering, right? The other one is vasoconstriction. These are the two things happening, right? It is going to increase the fever. Then slowly it is brought in a plateau phase. Later, when the other mechanisms such as sweating, heat dissipation is been acted, then the temperature of the body is lowered. This is how the body acts. Okay, even though the fever is so good, right? We were talking that fever is good. It is helping in inhibiting the pathogen, right? That is what I've told you, right? Even though fever is good, why do we rethink repeatedly? Because the increase in the fever is good in case of adults. Why? Because the hypothalamus here is well developed, whereas in case of children's, it is highly advised to monitor the fever properly, because it can overshoot. Remember this word. In case of children's, there is something called as overshoot. What is this overshoot? It is beyond the threshold. Okay, that much of amount cannot be taken by the baby. Why this overshoot is occurring, that is very important now. Because of immature hypothalamus. Okay, it cannot maintain, or the resetting part is gone haywiring. So basically, if this immature hypothalamus is there, that is causing overshoot, right? If this overshoot is happening, what are the two things you're going to see? One is protein denaturation, right? One is protein denaturation. The other one is what? The complications caused by the fever. In case of whom, that is very very important. Don't forget, I'm talking about the children or the infants or the neonates. Okay, those people, the fever is very very dangerous for them. Okay, so you should never neglect in case of them. Okay, so this is what I'm going to tell in this particular class. If you like this video, please do like, share and subscribe. In the future video, I'll going to mention regarding the fever patterns and different types of fevers. Okay, please stay tuned. Until then, bye bye.